Do your cats need a buprenorphine? What it does, dosage and side effects. Buprenorphine is one of the most common analgesic pain medications prescribed for cats, especially for short-term use following a procedure or painful injury. What is buprenorphine? Buprenorphine is what is called a partial mu opioid agonist. What does this mean? Opioid drugs are simply those that can bind to opioid receptors throughout the body. There are 4 recognized opioid receptors throughout the body, most of which have Greek letter designations: mu, kappa, delta, and opioid-like receptor 1. Individual opioid drugs can bind to these receptors differently. Some have a strong affinity for the mu receptor and less affinity for kappa. For example, a full agonist means that the drug binds to the particular receptor very tightly. A partial agonist binds less tightly. This does not mean that a partial agonist is weaker than a full agonist. In fact, at certain doses, we can see similar effects of pain relief. But at higher doses, a full agonist will have more pain relief activity, whereas a partial agonist's pain relief effect plateaus, and we can instead see more adverse effects. But at appropriately prescribed doses, a partial mu opioid agonist like buprenorphine generally demonstrates fewer adverse effects than a full mu agonist like morphine or fentanyl. In most animals, buprenorphine is not as effective for pain relief as other opioid drugs, but cats seem to have a special affinity for it, making it a very common pain relief option for them. What does buprenorphine do for cats? Buprenorphine is used primarily for pain control in cats. Compared to other opioid medications, cats appear to get better pain relief from buprenorphine than other animal species, while keeping the typical side effects seen with most opioids low. Some examples of situations where buprenorphine is used include surgical procedures like spays and neuters, dental procedures involving tooth extraction, painful injuries like bite wounds or other trauma, and urinary tract conditions causing pain and difficulty urinating, collectively known as feline lower urinary tract disease, FLUT. The different forms of buprenorphine for cats. In the veterinary medicine setting, only a liquid form of buprenorphine is typically used. However, liquid buprenorphine does come in 3 main different preparations. The first is Buprenex, which is a brand name for the most standard formulation of buprenorphine used in both human and veterinary medicine. When used in cats, Buprenex is versatile in that it can be given as an injectable at the veterinary clinic, but the same form can also be given by a special route called the buccal or oral transmucosal (ODM) route. The oral transmucosal route means that Buprenex can be very readily absorbed by the oral tissues inside a cat's mouth, especially under the tongue or pouches of the cheeks. This can be a very attractive administration route for kitty parents at home because this means a cat doesn't have to actually swallow the medication. As long as it gets in the mouth, a majority of it is typically absorbed. This absorption route, more specific to cats, provides a comparable level of pain relief to the injectable routes, though the time to peak effect may take a little longer. This form typically provides about 12 hours of pain relief for cats, though some vets may prescribe it for every 6 or 8 hours depending on the patient and circumstances. The second form of buprenorphine is a product called Simbadol, which is labeled specifically for cats. Simbadol is a higher concentration of buprenorphine and when injected under the skin by a veterinarian, can last for up to 24 hours. It can be given off-label by other routes as well, including the buccal/ODM route, but will then have a duration that's much shorter and comparable to Buprenex. The third form is a patented compounded formulation by Zoo Farm called Bup-SR. Bup-SR can only be given as an injection under the skin by a veterinarian, but can provide pain relief for up to 48 hours. Side effects of buprenorphine. There are some common side effects we may expect to see with buprenorphine in cats. Typically, their pupils get very dilated, which is an effect called mydriasis. Most cats will then also exhibit some behavioral changes, including excessive purring, rubbing on things, pacing around, and hyperactivity. These effects are typically mild, manageable, and even a little humorous, as your precious feline becomes overly lovey-dovey and tries to rub his head and neck on everything in sight. In uncommon cases, these effects can be more pronounced, leading some cats to become more agitated, disoriented, and restless. Rarely, some kitties may also exhibit gastrointestinal signs like vomiting, drooling, a decreased appetite, and an elevated body temperature.